Hi everybody, it's Dominic from Shift.ms. We're back with Professor Giovannoni from Barts in London. We've spoken to him before, but it's a slightly different theme to the discussion this time. And it's all about how the changes brought about by COVID-19 are impacting MS care. So I gather that you are sort of reporting for duty as an ordinary doctor, and this is going to be happening across the country. Is that right?
I think so. It just depends on local circumstances. But our hospital is, completely been inundated with acute admissions, and they're opening up a new hot ward. We're going to be looking after patients that are ill with COVID-19 that probably don't quite need intensive care, or they're stepping down, and so we will have to be monitoring them, looking after them, and then making a call when they need to go to intensive care. So it's going to be quite nerve-wracking, because I haven't done general medicine for 30 plus years. So this is something I'm going to just have to go diving in the deep end. I have been trying over the last week, 2 weeks, to catch up with some of the principles of managing sick patients with respiratory problems. So I think it's going to be fine.
You've been trying on scrubs. Have you found the right size yet?
Unfortunately, the scrubs are difficult to go by. Every time I try and go and get scrubs, they sold out. I mean, not sold out. The sort of hospital supply is finished. So I'm hoping that we can address it.
With all the MS teams really moving to the front line, I guess people are really concerned to know how will this impact their MS care delivery.
So we have one nurse who's just trying to do everything, and she's completely flat out. In terms of the MS neurologists, we're having to just do them, after hours, and I don't think we will be committed to the ward all the time. So we'll be like in spare times trying to deal with some telephone clinics, which is all what we're doing at the moment. But what we're going to have to, people are going to have to realize we're going to have to cut down our MS clinics to a minimum. We're trying to reduce the requirement for blood testing that's too frequent. The ABN had just put out guidelines to kind of support neurologists about reducing the blood monitoring. We actually are trying to set up in London. Bernadette Porter runs NeuroResponse, which is a social enterprise. She's trying to get a system in place where we'll do home phlebotomy. We feel very uncomfortable reducing the alemtuzumab monitoring from to 3 months, which is what's happening via the ABN guidelines. The reason for that is as you know, secondary autoimmunity can be life-threatening if you get ITP and the kidney complication, which is Goodpasture syndrome. So those types of monitoring requirements, those types of secondary autoimmunity need to be picked up and treated urgently. Maybe the blood tests and the urine tests are not that important. I think most important is patients being very vigilant about how they feel and monitoring them themselves.
That brings me on to one of my questions, because we always talk as if you guys, medics, the nurses, etc., do everything. But in these times, what can patients do to take the load off you, monitor themselves, and make their MS management go more smoothly? Can you tell us a bit about that?
Yeah, so one of the things we have to do every year is we have to monitor, for example, the impact of the MS on the person. So this is monitoring basically what's happening to your walking times, what's happening to your disability. So we've created a whole lot of online apps on our Clinic Speak website, where people can actually fill in a short question and get an EDSS score. They can do their own. They can learn how to do their own time 25-foot walks, their own 9-hole peg test, for example. So they can take responsibility of monitoring the impact of MS on their own lives. There's also online tools, and these will clearly expand over time, where you can actually prepare yourself very well for a telephone consultation. So you know the kind of questions your neurologist wants to know from you. They want an updated list of your medications in case your general practitioner has changed them or you've stopped taking medications. That's very important to have an updated list. So you can prepare for that, maybe even email it to your nurse or neurologist before the consultation with your disability, all your other scores. Some people with multiple sclerosis get recurrent bladder infections, you see, and they have to run off to their GPs or to their MS centers to have their urines tested. Now, people who understand about how to self-manage their bladder can actually buy the urine dipsticks, learn how to use them, and monitor their own urine, for example. So these are the kind of things that I think through this crisis, people are going to have to start realizing, actually, I can do a lot of self-monitoring. I can also do a lot of self-management, because lots of things can be looked after by yourself. And also, I think what will happen is we try to set up very rapidly what we would call group therapy sessions to help people with the mental health issues that are going to arise. We don't want to do it. We want people with MS to do it, so they can create little. I'm sure Shift has got this happening already. You know, you're communicating with each other, you're keeping each other, supporting each other, and that's where this crisis will help people. They must realize actually there's a lot we can do, independent of our MS clinicians and MS nurses. You know, we can self-organize.
I thought the MS Selfie website was excellent. Can you tell us a bit about that and how it may be a larger initiative?
What is happening is the patients were either emailing, phoning, texting, WhatsApping, because we do have multiple channels of communication. And even on our blog, people were asking the same questions over and over again. So I thought to myself, instead of, let's try and, if you answer a question for somebody, it may be relevant to somebody else, so you answer it in the open. So I created this, and also to try and curate information around COVID-19. So what I was trying to do is move some of the information onto a microsite using Google Forms, where people ask a question and I go back every day and I answer the questions from the previous day. The issues that did emerge early on with the COVID-19 pandemic is some of the generic advice you get from, say, the MS Society or the government website, MS Trust website is very generic. And some people with MS were finding it very difficult to personalize that advice, you know, in relation to their specific DMT or their specific treatment. So what I've decided is to kind of break a rule that we normally don't give personal advice, just because online. But this is a situation where I think what I tend to do now is anonymize it, but answer the question as if it's personal advice. So ideally, our General Medical Council has recommended that we shouldn't use social media to give consultations and give personal advice. But I think under these circumstances, this is a very, very unique situation. Everybody in the population has a small risk of getting severe COVID-19. You know, this is why, in an ideal world, we would stop everybody getting infected and wait for the vaccine to come along. But that's not going to happen. No, so I think what will change the level of anxiety is when the little sticks come around for testing to see who's had the infection. I don't know if you see the CDC, which is the Center for Disease Control in the United States, came out with a prediction that at least 25% of people, 1 in 4 people, who've had the infection with the coronavirus have had no symptoms. In other words, they've had asymptomatic disease. So I don't know. I may have had the infection myself, and I haven't had any symptoms. So I haven't had any flu-like illnesses or anything like that. If I get that, and that's going to be a finger prick test most likely. If that comes back and shows that you've got the antibodies and you've had their infection, you're probably then immune to getting another one, or relatively immune. And that's going to really change the game, because I can see people wanting to test themselves. And as soon as they find out that they'll be able to be relieved about getting out. Those particular tests are probably going to be rolled out for healthcare professionals first, to get the ones back to work that are immune. And I suspect the second group will be the high-risk groups. You know, people with multiple sclerosis who are on immunosuppressive therapies, maybe the older population as well. So this is where, this is why testing is the mantra of WHO, and it looks like our government is beginning to say the same thing. Let's test.
What Gavin was saying is slightly eye-opening, I suppose. Some stuff we've heard, some stuff maybe not. It's very clear that we are going to have a much greater part in the process, looking after ourselves and helping the teams to look after us. If you look down, as usual, there's the like, the share, the subscribe. It's on one side or the other, I'm not sure. Bit old, not very good at this. And the Gavin's MS Selfie website and other resources that we know the team always tries to put a lot in, so it's definitely worth scrolling down into the comments. Anyway, we will be back. We have more interesting people lined up. See you soon. Take care.